Almost there? More states are, but the CDC isn't. On the same day Dr. Fauci says we're heading out of this full-blown phase of the pandemic, 3 more states are rolling back mask mandates. New York, Massachusetts, and we're expecting an announcement from Illinois as well. They join a list that just keeps growing. But even today, the CDC is sticking by its recommendations that say masks should be worn by everyone over the age of 2 in areas of the U.S. with high or substantial COVID spread. As you can see, that is nearly everywhere, according to the CDC's definition. Let's bring in CNN's Bryn Gingras and CNN's chief White House correspondent Caitlin Collins now. Bryn, you're in New York, where certain mask and vaccine mandates are dropping as soon as tomorrow. Tell us more about what the governor is saying about this decision.
Yeah, so Anna, it was going to sort of go away tomorrow unless she decided to extend it. Essentially, Governor Kathy Hochul saying we're not going to extend it. We're going to drop this indoor mask mandate, which essentially up until this point, businesses, restaurants, grocery stores, they either had to ask for proof of vaccination or require people to wear a mask when they were indoors. So that is going away, which a lot of people, of course, as you can imagine, are very happy about. There is a little bit of a caveat here. If there's a local municipality like New York City, for example, that wants to put those mandates in place, they can. So it's not going away everywhere, but certainly it's a huge step forward for this state. I want you to hear what the governor said and what was behind her decision making.
Given the declining cases, given declining hospitalizations, that is why we feel comfortable to lift this in effect tomorrow. Now those numbers are coming down and it is time to adapt. However, we want to make sure that every business knows this is your prerogative. And individuals who want to continue wearing masks, continue wearing masks.
And so we're seeing the rollback of all these different mandates across many states, blue states in particular. When it comes to school and mandates on masks there, Governor Hochul here in New York saying, hey, not quite there yet. She actually wants to wait till the kids go through their February vacation, come back in March and do some more testing, look at the metrics, and then she reserves the right to make that decision. Other states, though, already moving forward with that. We know about New Jersey, Delaware today, Massachusetts. But again, it's happening very quickly, Anna, and we have started seeing not only just in the last few days, but again, as you mentioned already, we're going to see more states coming on board with this as well within the next, today to the following days.
And so that leads me to Caitlin, because you just spoke with the CDC director, which has been under pressure, the CDC, to change its guidance to better align with what we're seeing governors do. And while Dr. Walensky says cases and hospitalizations are dropping, she says they're still too high for this to be the right time to loosen restrictions. You pressed her moments ago about what these states are doing. What's her response?
Yeah, they're still very cautious on this idea of lifting these mask mandates, of taking these restrictions away. They say this is a local decision. This is being done at a local level. But you are now seeing state after state, including several of them that are blue states run by Democratic governors whose politics are obviously pretty closely aligned with this administration's, saying that they believe it's time to change this. And they're searching for new guidance. You've seen when governors have been here at the White House in recent weeks, they have directly asked the White House for guidance on how to move into this phase of the pandemic and what they should do. But when it comes to that guidance, the CDC says they are working on it, but they are not ready to make that public yet.
And when it comes to masking, should people be listening to the CDC or listening to their governors?
Caitlin, we've always said that these decisions are going to have to be made at the local level, and that policies at the local level will look at local cases, they'll look at how local hospitals are doing, they'll look at local vaccination rates.
Now, the White House did not outright disagree with these decisions that you're seeing governors make. They have said it's a local decision, but you also heard from Dr. Walensky saying that she believes you should still be wearing a mask indoors if you're in an area of high transmission. And if you look at a map of the country, that is still a lot of the United States, Anna.
Yeah, it's more than 99% of the United States. Caitlin Collins, Bryn Gingras, I appreciate both of you. Thanks. Let's bring in Dr. Paul Offit, an expert in infectious diseases. He is the director of the Vaccine Education Center at the Children's Hospital in Philadelphia. Dr. Offit, we'll get to what the states specifically are doing in a moment, but first, just your reaction to what CDC Director Rochelle Walensky told Caitlin Collins. If I was hearing it correctly, and beyond what we heard in that short clip, it's like Dr. Walensky is saying, on one hand, we don't agree with the local officials. We're not changing our guidance, but don't listen to us, listen to them.
Well, so I think we're moving from pandemic to endemic. We have about 90% of the population that either because they've been naturally infected or immunized or both are immune at least against or protected against moderate to severe illness. And we're moving into the warmer weather with what is basically a winter virus. So that's all good. And I think, end game is always a little bumpy. And I think what it's going to boil down to in the end is what level of disease or what level of hospitalization or what level of death we're willing to live with. Influenza, for example, is endemic, which is to say 2 years before this pandemic started, there were about 700,000 hospitalizations from influenza during the winter season and about 60,000 people who died. And we accept that. If we masked and we social distanced and we restricted travel, we would probably dramatically lessen those numbers, but we live with them. So the question is, when do we get to that point with this virus? And I'm not sure what it is, but we are getting there. The difference between pandemic and endemic really is whether or not it affects your life. We accept influenza, and so it doesn't affect our life, and we will get to that point here. But we should know that I think you're always going to need to have a highly protected community, preferentially by vaccination, because this virus is going to be around for I think years, if not longer.
All of what you said makes sense, but the problem, I think, is that the guidance we're getting from health officials is inconsistent now. Because if you look at the current CDC guidance, people in 99.5% of counties here in the U.S. should still be masking indoors. So now as more and more states simply ignore the CDC protocols and they decide to do their own thing. What is the role of the CDC now? Do they take the lead or do they follow?
Well, I think Dr. Walensky said it. I mean, she said, look, here's sort of a goal. We would like for people to be inside, at least for the next few weeks before we sort of move out of the winter and into early spring, to try and wear a mask indoors, knowing that, unfortunately, we still have only about 2/3 of this population that's vaccinated. And so let's try and do that. But she does at least willing to accede to the fact that communities that have fairly low spread, and there are communities that have lower spread because they have higher vaccination rates, can reasonably make that decision for themselves. So I think that makes some sense. But I can see where, as you move into the end game here, it's bumpy, and this is how that bumpy looks.
Well, speaking of listening to local officials, the man expected to become the top health official in Florida, Dr. Joseph Ladapo, he just yesterday refused to say if he's vaccinated. He's defending comments in support of unproven COVID-19 treatments. If Americans are supposed to look to their local health officials, what if this is the guy in charge?
No, it's disappointing. I mean, this has become a cultural issue. I mean, if you identify on the right, then part of that means that you say that that vaccines play a less important role here, which is of course absurd. If you look at countries that have high vaccination rates, meaning high 80%, low 90% vaccination rates, they're largely looking in the rearview mirror at this pandemic. Vaccines are our ticket out of this pandemic. It couldn't be clearer. You're far more likely to be hospitalized and die if you're unvaccinated than vaccinated. So that a state public health official would make that kind of comment just flies in the face of everything you know about the science here, and obviously it's very disappointing.
Dr. Paul Offit, I appreciate you. Thank you so much for taking the time with us.